Welcome to Between the Sheets, the podcast where we're going to cover a variety of topics related to sexual health and wellness. I'm Dr. Stephanie Zwonitzer, your host. I'm a nurse practitioner and have been in practice since 2017. I have my Doctor of Nursing Practice degree, and I specialize in urology and sexual health. I am so excited to explore all of the various topics related to sexual health and wellness with you in a fun, spicy, educational, and non-judgmental manner. So come on, let's get between the sheets. Hey guys, welcome back to another episode of Between the Sheets. Today we're going to talk about female sex organs, the female anatomy, to help you get a little bit more acquainted with that part of the female. So this is cis females, born female, female genitalia. Most of it will also transfer for trans females, except for some of the glands and stuff that don't necessarily transfer in that surgery. So for females, talking in the perineal area, okay, obviously we have our breasts and our nipples as well, which certainly can add into the sexual experience, as well as they are used for obviously breastfeeding for our babies when we have them, and can be a fun little extra play toy during sex. But I'm going to focus on the genital region. And so externally, we have the vulva. Okay, that's that whole area of the external genitalia between the female's legs. So that has the labias, the the urethra, the clitoris, the vaginal opening, the anus, the Bartholian and Skene's glands. Those are all down there in that vulva. These things go through changes during puberty, pregnancy, childbirth, postpartum, and menopause. So there's various changes throughout the lifetime for women of all of those organs down there. Internally, you have the cervix, the uterus, and the vagina, and then the accessory organs and the erogenous zones, like I mentioned, breast and nipples, obviously, but you can also have women getting turned on by their feet, their neck, their inner thighs, maybe behind the knee, any area that with a light touch or kissing or something might turn them on. And so those are areas to explore as well. Let's talk about the vulva area. So there's two different sets of labias. A lot of us refer to them as lips. Okay, so there's the majora, which are the big beefy ones on the outside, and then the minora are on the inside. They're much thinner and smaller. These provide protection to the urethra, the vagina, and the clitoris. Okay, so they protect them. So when you're sitting, there's something on top of the, between whatever you're sitting on and those organs. Those are the labias. These do swell during arousal. They become larger during puberty. They also become larger during pregnancy and during childbirth. Usually they go back down after those. Some women do end up having larger labia after kids. With menopause, they get smaller, thinner, more dry, unless we replace with estrogen. They can get longer with age, and sometimes there's like a thickness to the tissue, almost more of like a leathery kind of feeling than the softness when you're younger. And you can have changes in your labia also with fat loss or gain, so they can get bigger or smaller with fat. There's various thicknesses, there's various shapes, there's various colors, and that's all based on genetics. So whatever you have is what you have. You certainly can do plastic surgery if you want to. But what you're born with is what you have. And there's nothing wrong with it. If yours is bigger than your friend's or smaller or thicker or something different than somebody else's that you've seen, it doesn't mean yours is wrong. It's just how you are. They can get damaged. The labias can get damaged from consistent bicycling or other repetitive injuries, like sitting in a wheelchair. Wearing tight clothes can cause irritation. So you'll hear of vulvitis, which is an inflammation and inflammatory issue with the vulva. And a lot of times that is from either cycling, sitting too long periods of time, or wearing tight clothing. Inside those labias, you have the clitoris. It is the most sensitive sex organ for the female. There is an internal part of the clitoris and an external part. The external part is covered by what's called a hood, which very similar to men's penises. When they are uncircumcised, they have the foreskin. That's very similar to the clitoris hood. The internal part of the clitoris is very large, and so stimulating just the external part of it is not always good enough. Sometimes you can stimulate the internal side as well. The clitoris is made of erectile tissue and has over 8,000 nerve endings in the glands of the clitoris alone. So the glands is under the hood. There's 8,000 and nerve endings. So no wonder it's the most sensitive organ for female sex. Its single purpose is to experience pleasure. Has no other purpose in life except to make you feel good. So enjoy it and use it to its fullest. It can be enlarged with polycystic ovarian syndrome. Clitoral lesions can cause pain. So sometimes the hood of the clitoris and the glands can be kind of adhered to each other, and that can cause pain, especially during arousal when things are getting swollen. You can get cancer of the clitoris. You can have vulvar cancer, so cancer of that area originating, or you can get metastatic from breast cancer, cervical cancer, or endometrial cancer. So that's an interesting fact. A lot of people don't really realize that you can get cancer on your clitoris. Soreness of the clitoris can be from too rough of sex, too much cycling, too much sitting, too tight of clothing. So you really want to take care of your clitoris and have good health and down there. Pain can be, pain of the clitoris can be indicative of an infection, an injury, vulvar cancer, or lichen sclerosis, which is an overgrowth of certain parts of your skin that need to be treated, and you can go to a dermatologist for that. Itching could be an allergic reaction to products. It could also be BV or yeast, or other STIs can cause some issues with the clitoris. Behind the clitoris, closer to the anus and the vagina, you'll find the urethra. The urethra is the opening that our pee comes out of. It can be right next to the vagina. Some of us, ours is up inside of the vagina. The purpose of the urethra is to eliminate your urine. There are some people that get pleasure from penetrating the urethra. So some people will use toys or what's called a sound, which looks like a catheter, but goes in for pleasure, a finger, and some people are able to take a penis, which can be pleasurable for some females. It can be dangerous though. You can cause damage to the urethra doing this and infections. So you want to be very careful. Rough sex, even vaginally, can cause damage or inflammation to the opening of the urethra, and so being careful with that as well. Sometimes women will think that they have a urinary tract infection, but actually it's just inflammation and irritation from some rough sex. Pain with urination after sex can be normal, but it can with that inflammatory response, but it can also be abnormal or indicative of a UTI, so just be careful and keep an eye on that. Profuse bleeding would not be normal, so that would be something that you would definitely want to get checked out. A little tip is to void after you have sex. There is no research that proves that this prevents UTIs, but all of us know that it helps. And so make sure that you're peeing after having sexual activity, whether it is masturbation, penetrative sex, or just messing around. A lot of bacteria gets moved around in there. The recycling bin is very close to the pleasure zone. And so make sure that when things are getting moved around down there that you clean up really good afterwards with water and pee. And also after loose bowel movements, when you have diarrhea, a lot of bacteria is around down there. So make sure that you pee after having diarrhea as well. The next part of the vulva is the glands. So women have 2 Bartholian glands and 2 Skene's glands. The Skene's glands are at the top of the vagina, outside of the urethra, and the Bartholian glands are at the bottom inside of the labia majora. The Bartholian glands are pea-sized glands, and they help lubricate for sex. The Skene's glands are 2 small ducts, and they also help with vaginal lubrication. Both can get clogged or blocked and cause painful cysts. If that happens, you want to do warm sitz baths or warm compressions, and possibly if they're really significant and causing a lot of pain, you might need to do an incision and drainage that your physician or nurse practitioner could do for you. You can get infected in these areas, and not just a simple cyst, but an actually infected cyst, and that's when you would need antibiotics. So you'd also want to see your provider for that. The next part of the vulva is the vagina. It is a muscular tube that extends from the cervix to the vulva. It is what's also known as the birth canal, because that's what the baby's transporting from the uterus to the external world. The vagina elongates with arousal to allow penis insertion. It can go from 2 to 4 inches normally. and when aroused will elongate to 4 to 8 inches. So that's why women can take a decent sized penis, but also why men don't need to worry so much about their size, because it's only getting so big in there. So no worries if you're on the shorter penis length size, it's still going to fit in there nicely. There's 3 layers to the vagina: the mucosa, the muscle, and the adventitia, which is the connective tissue. So all of those work together to provide stability in the pelvic floor of the birth canal and the pleasure zone for sex. The cervix is at the top of the vagina and the bottom of the uterus. It is a passageway that connects the uterus and the vagina, which plays a role in menstruation. So when the uterus is shedding the lining, it comes out through the cervix and then through the vagina. It plays a role in fertility. It allows the semen to get up into the uterus so that the sperm can meet up with the ova, the egg, and make a baby. It also plays a role in pregnancy and childbirth. When women go and get their pap smear, this is what they're smearing. Okay, so they're doing their little brush and broom on the cervix to look for human papillomavirus, the HPV, and also other STIs. The uterus is a hollow pear-shaped organ, and its function is for carrying a baby, nurturing the ovum. It has obviously the menstruation, so it has the shedding of the lining when you're not getting pregnant. And then it also allows the baby to be in there when you are pregnant. And then during labor and delivery, it contracts and helps push the baby out. So it's a very important organ for women. Doesn't really have a role in sex, but definitely is part of the whole female anatomy and reproduction. All of these parts of women have different shapes, sizes, and colors. Again, nothing is wrong with you depending on how you look. It's just the way that your body is. Abnormal odors, discharge, bleeding, etc., those all can be cues for infection, cancer, or other issues. And so definitely wanting to keep that, looked at and know your own anatomy. Get a mirror out, look at things, feel the inside, know what you feel and look like so that you can know if there's anything abnormal. Make sure your partner knows and they can tell you, hey, you have this swollen area down here, or there's a blister here, or there's anything that's abnormal for you in particular that is really good for you to be able to pick up on, or your partner to pick up on, so you can take care of problems before they get any worse. So one common issue that sexually active women deal with is called bacterial vaginosis. It is an imbalance in the vaginal flora. So the normal bacteria that we have in our vagina gets disrupted. We normally have a good amount of lactobacillus, which kind of keeps everything the way that it should be. And it's the dominant organism in our vaginas. And sometimes it becomes overrun by other organisms. And that's when we get this infection. It is not considered an STI, although it is common in sexually active women. We're not exactly sure if it is transferred from person to person. We do know that women who do not use condoms or who use condoms inconsistently will have a higher rate of the infection than women who consistently use condoms or are not sexually active. So bacterial vaginosis it sometimes can have no symptoms, but usually has a change in your discharge to white to gray in color, and it's usually more watery than your normal discharge, sometimes even a little frothy. There's a lot of itching usually associated with bacterial vaginosis, which is also referred to as BV, and a very strong odor. Almost always it's considered a fishy odor. We should not smell like fish. I know there's a lot of jokes about female, the tuna or the female taco, things like that, the fish taco. We should not smell fishy. A normal vagina should have very little to no odor, and it should be a pleasant smell. If there is one, it should not be a fishy smell. So if it is fishy down there, make sure that you are getting checked out. Bacterial vaginosis can also cause preterm labor if you are pregnant. So I have a funny story with bacterial vaginosis. I've had it. I was in my early 20s. I was married. My husband and I, we were watching TV. We ended up having sex, and he literally stopped in the middle of sex and was like, Steph, I can't keep going. You smell terrible. And this was like so upsetting to me. Like, how could I, it's just so embarrassing. Here, your husband is telling you you smell bad. And that's something that women take such good pride in, is our cleanliness and everything. And so right away the next day, I made an appointment and I went in and had an exam done, and I had left a tampon in, and that's what caused it for me. So this is a very common thing. I was not the first person to ever forget a tampon in there or lose a tampon in there. I will not be the last. I have had patients with the same thing. So just be very aware that it's not a bad thing. It's easily treated. It doesn't mean you're a dirty person. It just is an imbalance of your flora, and is very easily treated. I had my tampon removed, got on my antibiotics. I was good to go. I have not had it again since, very luckily. But a lot of women struggle with this on a recurrent basis. Usually if you get one infection, having it recur within 3 to 12 months can happen very regularly. But some women are lucky enough not to have this ever, or to only get it a few times in their life. We treat it with antibiotics. The most common one is Flagyl, or metronidazole is the generic name for that. And so it's very easy treated. We have a really good plan in place. But yes, if you have an odd discharge, a weird smell, bleeding, go get checked out, because those things are not typical. You know what your typical discharge looks like, what your typical smell is, and when you're supposed to be bleeding if you're still menstruating. So definitely take your female health seriously and get things checked out when you need to be. It's time for my favorite segment of the show, Between the Sheets Shenanigans. We've got some great stories for you, and as always, the details of the stories will be changed so that you cannot identify who the owner of the story is. It might be my story, might be my friends or family members, or even a patient's story, but you're not going to be able to tell. Please send in your stories as well so we can shake up the details and share your stories. Send them into podcastbetweenthe.sheets@gmail.com. Let's tell some stories. Story time with Lady Bits. This is fun. So I did have a patient who had very long labias, and she was very embarrassed by it, but it was also that it was uncomfortable for her. She felt funny in swimming suits. We all can see a camel toe here and there, but hers was very evident no matter what she wore. So that was frustrating for her, but it was also uncomfortable when she would go bicycling, when she would sit for longer periods of time, because there was just this extra tissue there. So she actually had plastic surgery and had that taken care of, and she's been very happy since. She has a very pretty vagina and pretty labia now, and she's much happier. She can wear what she wants without having to worry about the self-consciousness of it. So that was a really great outcome for her. One thing that can happen with women's organs, usually later in life, usually after we've pushed out several children, is prolapse, where either the bladder, the rectum, or the uterus comes down through the vagina. Sometimes it comes down far enough that you can actually see it externally. So when I was in nursing school, I worked in an OBGYN clinic. This is many, many years ago, back in the early 2000s. And I went in to chaperone one of the male physicians during a vaginal exam. And I had never seen a prolapse, didn't really know what a prolapse was yet at that time. And here the lady goes up in stirrups. We lift the blanket up, and there is what appears to be an alien head staring at me. I mean, you could see where the little cervix hole was, and the whole thing was just hanging out of her vagina. And I thankfully was wearing a mask, and so hopefully my facial expressions didn't show very well, because if you know me, my face tells everything that's inside of my head. But it was very interesting to see that. So then I learned a lot about it and what happens. And now I treat it all the time on a regular basis. I see women every day for prolapse. I do something for them called a pessary. It's a rubber, essentially, ring or disc that goes up in their vagina to kind of hold everything taut and put it back up there. But that was a very interesting thing to see for the very first time. And now it's something I do on a daily basis. So it was interesting that that has kind of come full circle for me and is no longer scary or awkward or alien looking. I'm very used to it now, but it was interesting to see that for the very first time. And I can vividly remember just the shock that I went through in that room. For women whose cervixes don't fully dilate when they are pregnant and in labor and delivery, they may need to have a C-section because their cervix just doesn't do what it's supposed to do by thinning out and opening up for a vaginal birth. So then they do a C-section. I had 2 C-sections, so I'm very familiar with that part of it. I have never pushed a baby out. And mine was, the first one was when I had my daughter, was because I did not dilate. And so a lot of women will go through this feeling of, I'm not a woman, my body didn't do what it was supposed to do, all of these feelings, and it does not make you less of a woman. Some of our bodies just don't do all the things that they're supposed to do when they're supposed to do it. And that is our whole bodies, not just our cervixes, but also our cervixes. And so that can happen during childbirth, and it can be a pretty traumatic experience for a woman. So support her during those times if you can. But just to encourage all of you, I am still a mom. I'm a great mom. And it had nothing to do with how I pushed the baby out or they surgically took the baby out. They're still my babies. And it doesn't make you any less of a woman to not have your cervix dilate appropriately. My last story for you today is that I had a friend who was very self-conscious for absolutely no reason. She has a very pretty vulva area, and she was so self-conscious she would never let her partner give her oral sex. And so we kind of talked through things and said, this is really, it's a pleasure for you that you're not letting yourself experience, but it's also really nice for your partners to give that gift to you. That is something that partners really enjoy, both women giving oral sex and men giving oral sex. It can be a very bonding experience. And so we were able to kind of talk through it, and she did try a couple of times, and finally she got to the point where she very much enjoyed oral sex and she did not have to feel that self-consciousness anymore. And her partner was very good at encouraging her and telling how beautiful she was, and she tasted good and smelled good and all of the things that go with that, so that she could relax into it and enjoy the oral sex. So that was really great. So just get over your self-consciousness and enjoy the pleasure down there. Thank you for listening and spending time with me today. You can catch new episodes of Between the Sheets every Wednesday, because what better way to add some spice to your life than to have a new podcast on Hump Day? We will continue to explore common, uncommon, and taboo topics related to sexual health and wellness. Please send any comments, questions, or stories to podcastbetweenthe.sheets@gmail.com. That's all one word, podcastbetweenthe.sheets@gmail.com. Have a great day. And remember how important it is to discuss these topics with your friends, your family, and of course your partners. In fact, you can follow, and share this podcast so they can see it too. See you next time for more sexual health topics Between the Sheets.